The purpose of today's video is multiple endocrine neoplasia type 2. This is a rare heritable autosomal dominant condition which is passed down the generation by alteration in the RET proto-oncogene which lies on chromosome 10. Means that this condition represents the potential for the affected individual to exhibit multiple problems in the endocrine or the hormone producing glands. However, it may have variable penetrance, hence not all children will be affected equally. These tumors can be functional, i.e. they can produce hormones. They may be non-functional, where it is just the mass of the tumor that causes symptoms and complications, and these tumors will have variable malignant potential, so they can be on the one end the benign spectrum towards the more malignant spectrum. Here in the cartoon you can see the thyroid gland in the neck, and in the corners the parathyroid smaller glands which are important for calcium regulation, and in the abdomen the cartoon shows two kidneys, at the top of which are the adrenal glands somewhat disproportionately drawn. The tumor types associated with MEN type 2 are the thyroid, predominantly the medullary thyroid cancers. These are the calcitonin producing cells within the thyroid gland, and once diagnosed a total thyroidectomy is mandated. When there is hyperactivity within the parathyroid gland, excess calcium is secreted, causing symptoms associated with hypercalcemia. And then finally within the adrenal gland, just on top of the kidneys, pheochromocytomas are the commonest, which increase the adrenaline, noradrenaline, also called epinephrine or epinephrine, to be secreted in huge amounts, leading to high blood pressure and its associated complications. Now let's look at the subvariants, and these are mainly type 2A and MEN type 2B. The MEN type 2A are further subdivided into the classical, which are medullary thyroid cancers, pheochromocytoma, and primary hyperparathyroidism. The MEN2A can also present with cutaneous lichen amyloidosis, a skin condition, or with Hirschsprung's disease, which is a developmental condition associated with severe constipation due to problems in the neuronal network within the gastrointestinal tract. And finally, medullary family thyroid cancers, but without the pheochromocytoma or parathyroid hyperplasia. All of these are subtypes of type 2A. Type 2B are medullary thyroid cancer and pheochromocytoma primarily, but others include mucosal neuromas, intestinal ganglioneuromas, and marfanoid habitus. To diagnose this condition, one has to have a high index of suspicion when one of these tumors appears in young people, that is less than 35 years of age, or if more than one tumor type appears in the same individual, or if there's a family history of MEN type 1 or MEN type 2 tumors. These symptoms ought to be investigated and the hormone levels checked, as well as for activity of other tumor types and the serum chromogranin A to complete the assessment for endocrine neoplasia. Scans may be needed depending on the tumor type and location, and finally gene testing for the affected patient and for the family members as appropriate. It is very important that the treatment or management of these complex conditions ought to be carried out in specialist centers that has the relevant experience, technology, know-how, and resources to deal with this complex condition. The first step, of course, is to assess the patient, to narrow down the tumor type, and then, of course, treatment, which in most cases is surgical resection. MEN type 2 mandate removal of the thyroid gland to prevent future occurrence of medullary thyroid cancers. And once this condition is diagnosed, then the patients would be under surveillance to ensure that other tumor types do not crop up. And finally, family members are also tested, and those found to have the relevant genetic makeup benefit from genetic counseling. They would benefit from genetic counseling. This completes this brief overview of MEN type 2. If you have any comments, please do share.